Hi, I'm talking to Aviva Yoselis today. Aviva is a woman's health educator. Hi, Aviva, how are you?
Hi, how are you doing?
Very well, thank you. Aviva, what is a woman's health educator? Can you tell me a little bit about this and your personal journey into this work?
Yes, actually, it is a career that doesn't quite exist in Israel as a profession. It does exist in other Western European countries, and slowly it's becoming more of a concept here in Israel. It's focusing on health education, which really is not about just people learning information, but it's also about teaching people how to change their health behaviors, specifically in the field of women's health. Although women's health covers a wide, variety of fields, including infant health and child health, because women are the most connected to the infants and to the smaller children.
What sort of services do you offer? Who can come to you for help?
That's a very good question. I see a whole host of women, for example, women who are having infertility problems and they don't understand exactly why. They don't understand what the doctor is telling them. They don't understand the tests that are available. They want to, understand their medical situation better with someone who can sit down and explain things to them. And it's also part of navigating the system. They want to know, okay, where and when do they get the services and the tests that they need to do. It could also be somebody who's suffering from a chronic illness, somebody who has diabetes, who wants to know, first of all, again, wants to understand their medical situation, and then wants to know how do they change their health behaviors. It could also be the acute situation. I have people who I help who are oncology patients, and they need to understand, again, what are their options, what kinds of doctors are out there, what kinds of different treatments are being offered, and again, how can they navigate the system.
You also work a lot with first-time mothers. What exactly do you help them with, and is this only before the birth or before and after?
It can really be from when a woman first gets married, where I meet with her and I discuss aspects also of the relationship with her husband and also the issues of fertility. Then we can also meet when she is pregnant, again, to understand a lot of women today. That's the thing with the internet. There's so much information out there on one hand, but on the other hand, people don't know what to do with that information. There's no screening for them. It's very difficult to say, okay, how do I make a decision? It's like if you go to the supermarket, it used to be, you had 2-3 brands of cereal, so it was pretty easy to choose what you wanted for breakfast. Now there's 20 different types on the shelf. It could be low fiber, high fiber, organic, has vitamin additions, and you need to make a decision. It's the same thing with your health care. There's so much different input. You have to figure out what's good for me, what does it even mean, and then how do I go out accessing the care that's right for me.
Do you only consult with people one-on-one? Are people able to contact you through a medium like, let's say, Skype? Would you be able to help somebody like that?
First of all, I do private consultations. I also do a lot of lectures in the community. Different organizations invite me to talk about various topics. But the Skype is also a possibility for a lot of people who either aren't mobile for whatever reason or there is a distance. Now, because I'm in Israel, I have an expertise in the Israeli medical system. So in terms of navigating the system, it's very different than in other countries. But in terms of understanding medical terminology and medical issues, so that's, for the most part, an international issue.
Thank you, Aviva. Thank you so much for talking to me today.
Thank you.